Here are 5 hidden signs and symptoms that your body might be low on potassium. Number 4, heart palpitations or an irregular heartbeat. Having proper levels of potassium is absolutely essential to having a regular heartbeat and proper nerve conduction in the heart, proper muscle contraction in your heart. If you have low levels of potassium, if you have that hypokalemia, it can lead to you having irregular heartbeats. It can lead to you having skip beats in your heart, and it ultimately can cause very serious problems like you not being alive, okay? It's very serious that you have proper levels of potassium in order to have a good functioning heart. One little known fact is that certain medications can cause you to have low potassium in your blood. Medications like diuretics or water pills or other blood pressure medications. So if you find yourself having an irregular heartbeat, palpitations, skipped heartbeats, it's important that you not just sit home and try to figure it out on your own. Call your doctor immediately or go to the emergency room, because having low potassium levels can definitely cause irregular heartbeats or arrhythmias. Question: did you realize that something like constipation or an irregular heartbeat could be tied to low potassium? Number 5, numbness and tingling. Having proper potassium levels is important for allowing nerves to send messages throughout the body. It helps with those electrical impulses by nerves. And so if you have low levels of potassium, this can cause nerve conduction issues and disrupt these messages, and that can lead to tingling and numbness. Really, it oftentimes happens in the fingers or the hands, the toes, the feet, even the arms and the legs. Now, if you find that these nerve issues, this numbness, this tingling, if it persists, even if you have proper potassium in your diet, again, make sure you talk to your doctor right away, because you don't want to miss a larger neurological problem. But do understand that having tingling and numbness really can be due to low levels of potassium. I always want you to see your doctor routinely for regular health checkups, regular histories and physicals, but here's when you need to see your doctor as it pertains to symptoms that could be related to low potassium. If you have heart palpitations or irregular heartbeats, you definitely need to contact your doctor. Also, if you have severe muscle weakness, especially if it affects the way that you're able to breathe. I certainly want you to contact your doctor if you have paralysis, or if there are portions of your body that are so weak that you can't even move them at all. And you should certainly talk to your physician if you have digestive problems like severe constipation or bloating, especially if these digestive problems get to the point where you're not able to take in fluid or food adequately. Even on your routine doctor visits, I want you to talk to your doctor about potassium. Even if your doctor doesn't bring it up, I want you to mention potassium and ask about it. If you are having just some persistent symptoms of fatigue, tiredness, muscle cramps, make sure you know your potassium levels. Also, if you're taking medications that could lead to low potassium, I want you to ask your doctor specifically about potassium. So if you are taking some of these diuretics or water pills, such as Lasix or furosemide, hydrochlorothiazide or HCTZ, ask your doctor specifically, is my potassium okay? I certainly want you to talk to your doctor about potassium if you have certain medical conditions that can affect your potassium levels. I am a kidney doctor, and I can tell you, having chronic kidney disease can affect your potassium. Also, diabetes can affect it as well. When you think about chronic kidney disease, usually my kidney patients have high potassium levels. And so I want you to ask your doctor, because if you are someone who tends to have high potassium levels, then certainly the routine recommendation for potassium intake is not going to apply to you. And I'll go ahead and tell you that for most people, if they regulate potassium normally in their body, it's recommended that they take in about 4.7 grams of potassium per day. If you're someone who needs a potassium restriction, like many of my patients with advanced kidney disease, then your doctor or your registered dietitian might limit your potassium intake to 2 grams per day. It varies, so make sure you consult with your physician. If listening to this conversation that we're having about low potassium symptoms makes you think about symptoms in yourself and you think, hey, maybe I have low potassium, please don't run out and take potassium supplements without first consulting with your doctor, because again, these symptoms could be due to something else. Make sure you set up a doctor's visit, and when you go, be prepared. Have a list of symptoms and the timing of the symptoms. Make sure you're prepared to talk about the different foods that you eat. Do you eat a diet that's high in potassium-rich foods like bananas, like oranges, like nectarines? Be prepared to talk about diet changes and fluid intake, and definitely always take a list of your medications to the doctor. Not just medications that have been prescribed, but also supplements or herbs that you may be taking. There you have it. We just discussed many of the symptoms of low potassium or potassium deficiency that can often be confused with other problems. So if you're experiencing things like weakness and fatigue, muscle cramps, digestive problems, heart palpitations, tingling and numbness, yes, these symptoms can be caused by other problems, but it is possible that they can all be tied to a deficiency of one mineral or electrolyte, potassium. Make sure you know your potassium levels, whether they're high or low, and that you have a good understanding of the foods you need to eat to maintain a potassium level that's normal for you.